So I will try to be quick. A lot of my messages are consistent with what we have heard earlier. So, and I want to actually focus on my last slide because I'm hoping to get some nice inputs from the audience on some work that we have that's ongoing. So my name is Emily Sinnott. I'm from the World Bank. And at the bank, we've been involved in a lot of aspects related to aging for years, and we have some of the key people here today. We're bringing together work that we've been doing in many different areas, from care to poverty and equality, to labour markets, to firm-level productivity, to health, to well-being. At the moment in a regional report, which will be available early next year, and we'll be presenting in Poland. So here today in 10 minutes, I wanted to just present some key messages shortly from this report and get some feedback. Obviously, the focus here is labour markets, so I've focused on that part of our work. There's a concern often brought up by economists, macroeconomists in the room are generally pretty guilty on this, that aging is going to have very bad impact on growth prospects in the future. Because of a decreasing labour force as a share of the overall population, will, number one, reduce the output of the economy, and two, there'll be a kind of fiscal drag due to pensions, etc. We hear this a lot. And also, indeed, of those people who are still working, a concern is raised that if you have aging of the labour force, you may have outdated skills, reduced productivity. So we've heard earlier today from different presenters that actually a lot of these are myths, and we don't find much evidence in the literature or from empirical analysis that people are involved with to support this. And I think our report very much comes out, and our work comes out in this vein. So the first point I want to raise is that we're focused far too much on a fixed chronological age definition of dependency as economists. So whether you read, economist articles, newspaper articles on the aging topic, there's a fixation on aging as time from birth, and on dependency ratios, ever rising, ever increasing, and this is not the right focus, and particularly given a lot of gains in health that we've seen in countries in recent years. Really, the evidence suggests that 50 is the new 40, 60 is exactly. So there's not much support for actually keeping a focus on these kind of fixed age dependency ratios. And earlier on, I think Nicholas Barr very much discussed that we should have a kind of flexible approach to aging and pensions, and really adjust as aspects with the aging population or developments emerge. Our pension systems will need to adjust and be flexible. That's to changing functionality amongst older people. But in general, in the topic, we need to be very aware that people are aging differently now, but also that people are aging differently across countries. So unfortunately, Poland, as with some neighbouring countries, Eastern European countries, is somewhat behind in terms of the life expectancy gains and health gains that we've seen across many advanced economies in recent decades. So while age is not a concept fixed over time, and 60 may be the new 70 is the new 60 for some countries. This type of development has not taken place everywhere. So here, this is just one way of measuring how health has changed over time for countries. And this is a very crude measure of health, mortality. What we're looking at here is what type of, how old you have to be today to have the same mortality as a person who was 60 years old in 1959. So in 1959, a person in France at the age of 60 had the same life expectancy as a 71-year-old would have today. And this is a kind of crude measure, but you can also find in the health literature measures that correlate to this based on functioning, whether it's on grip strength or psychological functioning. And what you can really see here, and this is for women, so this is actually the much more positive element of the story, because you can see that all countries have gained in this graph, but the gains, of course, are very different. So, for example, in Russia, the gains are very small. If we look for men, there are actually negative impacts. So people in Russia in particular, you can see this, are actually live less years after 60 now than they did in 1959. So dependency ratios really are focused on disability and how much are inactivity and how the population in general will have to support these people who are not working or who have big care needs. So another way of looking at dependency could be looking at a definition that focuses on disability. So here we show this, we contrast these two kind of approaches for Japan and Hungary, and it's interesting to see a reversal in ranking depending on which agency or definition of dependency you're focusing on. So here we have the standard old age dependency ratio, and Japan, as you can see, is 35% of the population is over 65. So they face, the most advanced aging economy in the world. Hungary, another economy that's aging, is at 25%. But if you actually measure dependency as the number of adults over 20 who face significant disability relative to the general population over 20, you see that this ranking reverses. In Hungary, we have a much larger share of the population over 20 who experience disability relative to Japan, where people lead fairly healthy lives. So this is another way that we could look at dependency, and this brings forth the health challenge, really, which accompanies aging in many countries. So if we're looking in terms of the labour market at dependency, something that what we tend to focus on is just the working age population. But as we've discussed, many people of working age in European countries are actually not active or are not working. So if we assume that this situation changes in countries and that over time countries merge to the position of Iceland, where you have and it's a very optimistic assumption, but where you have the highest participation rates in the world and very high participation rates at elderly ages, then we've contrasted this for different groups of countries. Poland is included in the EU 13, that's the 13 member states that joined after 2004. What we see is actually these kind of dependency ratios. So this shows the active in the labour force over the inactive in the population. We see actually that you could have relatively stable ratios over time. On productivity. So on productivity, the evidence is pretty mixed. I'm not going to go into it in detail here, but one aspect that is of concern is flexibility. So there's a lot of evidence that older workers are less flexible in terms of changing jobs, changing sectors, changing firms, and changing where they live or moving to get a job. And that's of concern, certainly. On innovation, similarly, we do have evidence that a lot of innovation takes place before the age of 40. If we're thinking of 50, if we're thinking of innovation as inventions, patents, etc. In terms of productivity, the firm level data, as we've discussed, is mixed. Actually, the evidence is pretty mixed. So some find some age effects, some don't. This one study found that labor force productivity peaks about at the age of between 40 to 50 using cross-country panel data. It's just an association. If we were to believe this, then we would think, okay, actually Europe and Central Asia, here we contrast the experiences of some European countries. This is looking at the age structure of the labor force here for these countries, that actually many countries are presently at this peak productivity stage with the majority of workers between 40 and 50. However, these things change over time, and I think it's very difficult from panel data evidence in the past to make conclusions about what's going to happen in the future, because we've seen health conditions certainly change substantially. And from the psychology literature, and we had a very nice exposition from Vincenzo on this earlier, we actually find that the evidence is not conclusive that people's functioning, be it physical or mental, declines over time. This is one interesting study where they actually put people into brain scanners and they did memory tests on a variety of memory tests for young and older people. And they found, they divided it into two older groups. Those that had low memory retention, so they performed poorly in the tests, and those that actually performed very well as the younger people. And what they found is that the people who performed relatively well had adapted as they got older and were making up for skills that they had lost by using other parts of their brain. So what you see in these low performers is that they have a very lateral approach when they're trying to memorize. They're mimicking themselves at a younger age, whereas the older high achievers have a bilateral approach and are actually using this part of their brain that connects, which actually brings in experience and connects episodes to things that they're required to memorize, and allows them to retain information better. So there's some divergence, and this is something we'll get to later, because this divergence across people is very important. And I think the psychology literature is well ahead of us in economics in looking at this, and it's very important for us to continue drawing from that literature. So, myth one, we've discussed this earlier on today. I'm not going to present the evidence here, older workers want to work. In many surveys, that's what you see. And they don't prefer to retire. They actually prefer to have a more flexible and a more phased approach to retirement. Secondly, this myth that older workers are less productive and more difficult to hire. There's mixed evidence, and in any case, these things are changing a lot over time and not fixed. The lump of labor fallacy, well, it's a fallacy, and we've seen evidence of that earlier today. But something that we really do have to actually confront is that older workers face significant barriers when looking for work and in the workplace. Okay, sorry, mostly from... So here we give some evidence from surveys, but there's a lot of firm-level evidence, I think, that supports this, that the attitudes of employers to older workers is very bad. And they're often excluded from training. So we really need to look at this bias against older people in society and confront that on the policy sphere. For the less rich aging societies, there's a huge challenge, and that is to make older people healthier, make older age healthier. Here we look at male and female life expectancy at the age of 50. The light blue bar shows the years of life you can expect to have remaining at 50, and the darker bars show how many of those years are healthy. So you can see Poland is here, and you can see that Poland has much less healthy years than the better performing, say, Nordic countries. And that's a significant challenge. And then I haven't presented it here, but there's also a significant challenge in terms of inequality. So if we look at bad health in Poland, 2/3 of the differences in life expectancy between Poland and Germany are explained by the much higher inequality in outcomes in Poland. So this is something that has not been studied enough, but it's something that we really will need to focus on. Similarly, the inequality over the life course in employment outcomes and education outcomes is very high in the less rich aging countries, and so having a positive outlook for these economies will really rely on confronting that challenge. Then finally, I wanted to leave with one piece of work that we're doing. The huge challenge, and something we really want to highlight in our report, is to bring evidence to the forum when we're discussing aging. There's been a lot of work done from researchers on share, for example, in Western Europe, and a lot of work done on the US, but really there's a paucity of research on the less rich aging economies. This just highlights one of these areas, which is lifelong learning, and we know too little about what works on lifelong learning and training programs for older people, particularly in, say, our set of countries in Eastern Europe. So here I show a piece of research that we've begun with the government of Latvia, and these are some preliminary results. Latvia, like the Nordic countries, has created an administrative database which covers the whole population using their social insurance database, linking it to the employment office database and the population registry. And this has allowed us to look at and to kind of get an evidence base on a number of social policy interventions. Here the focus is on ALMPs. They wanted to look at, they have over 100 ALMP programs that older people participate in, and we wanted just to get a first idea of what are the employment impacts of these ALMP programs. So here I just give a summary of some of the results we found so far. And this graph shows the marginal effects of ALMP, participating in an ALMP employment training program, on the probability of being employed 18 months afterwards. And actually, we find a pretty positive effect for all programs. We look at this and we divide this effect into younger males and females. So that's the 15 to 24-year-olds and also the 50-plus population. And what we find, and it's very much in sync with the psychology literature, is that for older workers, very targeted programs that really concentrate on skills you're going to use in your job and every day work very well. So for example, in Latvia, many people don't speak the Latvian language due to history. So what we found is that these language courses, this is the state language courses, work very well for both older females and older males. We also found that basic IT skills worked very well for the 50-plus population. And we found that well-designed training programs that are provided by skilled professionals who are in outside training agencies work very well for people of kind of older age, particularly when they're very focused on the profession that people are working in and the particular skills they need for their job. And this is a work in progress, so we're looking at some more aspects of these training programs, and we're also looking at the cost. But we'd be delighted to have any suggestions of what might be interesting or to continue discussion on how this work could be developed following this presentation. Thanks.